A Community Analysis by Joseph Boyd, Nursing 4636, St. Petersburg College, Professor Lori McGill. Historical Overview, Brandon, Florida. Brandon lies between Plant City and Tampa in Hillsborough County. It covers 42 square miles and borders I-75, Seffner, Valrico, and Riverview. In 1857, John Brandon and his family arrived in Fort Brooke, which is now Tampa. They found Tampa too urban and moved east to an area called New Hope, or Seffner. By 1890, the population was 417, and the town was named Brandon after John Brandon. By 1910, almost 600 people called Brandon home, and in 1957, Brandon was booming with over 8,000 people. Today, Brandon has over 112,000 people and 8,900 businesses. This community is structured, but in 2001, Florida had 5.5% of the United States population and only 2.8% of the road mileage. It hasn't changed much in the past few years. Traffic is an issue that community members see as problematic in Brandon, and during the winter months, the influx of snowbirds, lack of hospital space is another structural concern for community members. The population of Brandon mirrors that of Florida, but during the winter months, the elderly population in Brandon surges. This can put a strain on local businesses and healthcare. The elderly can find themselves without adequate medical space. Hospitals fill up, and some of the sick elderly must be taken many miles from where they reside to receive medical care. Healthy People 2020. Mental health care. From children with developmental disorders to adults with mental issues, mental health care in Brandon needs more funding. In the U.S., 18.1% or 43.6 million adults over 18 suffer from mental illness. Mental illness is cause for 43,000 deaths each year, and suicide is the 10th leading cause of death in that age group. Tobacco use. Each year, over 480,000 people in the United States die of smoking or tobacco-related illness. During my windshield survey on the streets and sidewalks, many people in the Brandon area were seen smoking. A community smoking cessation program could be instilled to help prevent death and costly medical expenses incurred by smokers and people who inhale the secondhand smoke. Elderly care. In the U.S., 60% of the elderly 65 or older must manage at least 2 chronic diseases. That's 46.3 million people. They need our help and support. Each winter, the snowbirds come to the south, escaping the frigid weather of their home states. Local hospitals and clinics are quickly at maximum with elderly patients. Elder care facilities in and around Brandon are at capacity, with more facilities and beds and funding needed. The environment. The American Lung Association gave an F to Hillsborough County for air quality. With the water pollution scare at Mosaic dig site, pollution of all sorts is a big concern with the people in the Brandon community. Public policy. The new budget has increased funding for the poor and the indigent health care in Hillsborough County. Both indigent health care and low-income plans have received more funding this year. Infrastructure and roads are a concern of the community. Most of the policy debate is on infrastructure and roads to combat the traffic issues in Brandon. 6 community needs. Winter health care. In the winter, with the influx of the snowbirds, the healthcare system is strained. Staffing and facility changes should be looked at to accommodate these new populations. Stronger police presence during times of tourism or when the snowbirds are in. Although crime is relatively low in Brandon, it does spike when the elderly population increases. A stronger police presence during these months could help deter crime in certain areas. Improved parks and walking tracks with lighting. Walking is one of the best forms of exercise. Lighting and security would go far in helping the elderly population get more exercise. They will not go walking if they don't feel safe. Road improvement projects. This has been mentioned before, but the roads need work in Brandon. The traffic is a major complaint of the people in this community. Smoking cessation programs. Smoking cessation programs can improve the community's overall health and bring down medical costs, possibly freeing up funds for more hospital space during our peak times. Increased Section 8 housing. In Brandon, the relatively small amount of Section 8 housing could be increased to help those in need afford better homes. This will improve the quality of life and eventually their health. A global issue. A Pew Research poll in France suggested that 83% of elderly patients see a doctor either the same day or the next day after requesting an appointment. That is contrary to the United States, where only 57% say they see a doctor that quickly. Our elderly is a growing population that manages multiple chronic diseases. They need the funding and the support to see doctors sooner rather than later. Thank you for watching.